Hello, I'm Sean Park, prosthetic urologist practicing in Seoul, South Korea. I'm dedicating my practice into the treatment of the erectile dysfunction, especially a surgical option which is inflatable penile prosthesis. Finally, this textbook was published recently, and among them, I had the honor to write the chapter 11 in this book. So it was about how to manage the complication of the subcoronal approach. It always feels somewhat weird that watching your work published in a paper form or hardcover textbook like this, but at the same time very rewarding. I'm a private practitioner. There's a tendency that they want to divide the academics and the private. Those who are in the academics, they focus more onto the academic activity, and those who are in the private practice, they focus more onto the let's say just clinical stuff. However, if we watch famous hospitals or famous medical institutions, they have three main pillars. The first one is, of course, clinical activities like dealing with the patients. And second one is almost always research about those studies they do. And the third one is an education. At first, I couldn't understand why those three were their mission. But now, for about 15 years, now I understand and I experienced it myself. Medical informations or the studies, they are advancing really fast these days. Let's say if I have to write a paper, then I have to do the more researches and get the references, read other papers. In doing so, I am acquiring new information about my field. And when you do the education, when you teach other or show other surgeons how you do it, they will give you feedback. They will ask you why you do that or how you do that, which gives you a chance to retrospectively analyze your surgery and think it more objectively. In that moment, then you understand that you can improve this way, or you can delete this process, something like that. All these things result in that you will do so-called better surgery or treat your patient better. And if you do that, that will enables you that you can write a better paper and you can teach others better, things like that. It's all in a chain reaction. Just treating the patient and just focusing on the clinical aspect is not enough to be properly updated so that you can give them optimal care. These three things should go at the same time. When I first tried to attend the academic activities or go to the conferences overseas, many of my colleagues who are running private practices said that does not help you immediately. However, in the long run, it has been more than roughly 15 years now for me. Those who kept their academic activities and those who didn't, definitely there's a big gap between those two groups. It is a destined path. If you stop studying, you can't update your practice properly. This textbook, now they want to upload the videos as well. Surgery they should be able to see it in the video as well, right? So that they can understand better. So it was not just writing some text or putting up the photos. No, I had to put all those things on the video form as well. After all those work, watching this book published is a huge joy. So I kept that in my practice. So this reminds me that you need to write the paper and you need to do the academic activities because it cannot be separated. If you stop your academic activities as a practitioner, especially in these days, you won't be able to provide an optimal care. The reason why I was able to write this chapter was I'm doing the subcoronal approach, I'm doing the local anesthesia, which is now a little bit more popularized. This all was enabled by the patients who came to me, who get treated and who spend time with me. So I'll just keep studying it so that I can provide a better and optimal care to my patients.